All, this is Dr. Mobeen Sayed from drbean.com. As promised yesterday, we are going to go over various drug choices that have been used for COVID-19. So let us start our discussion. I'm going to share my screen. So one primary document or the prescription model or protocol that I'm going to use for the basis of our discussion is going to be the Math Plus protocol. So this is kudos to Dr. Paul Merrick, who has been with us as well. So I have taken a lot of inspiration from his discussion. Then we have some other doctors whose work has been cited as well. So I would name as much as possible for various doctors and their experiences. So with this, let's start our discussion. So the first of all, if you go here, so first is the disclaimer. So please make sure that the drugs that are discussed here are not a prescription for any single person. These are not prescriptions for you. And then if a drug has to be used, that has to be used with your doctor's advice, and the dosage and the prescription and how long to take it and what is your comorbidities. And based on that, what is suitable and what is not suitable is very important for you to talk with your doctor. Some of these drugs over here can actually be lethal. They can be fatal. So just be very, very careful. This discussion is for educational purposes only. So let's start. First of all is the prevention of the COVID-19. So the most important part of the prevention are, of course, masks, lockdowns, physical distance. I don't want to call it social distance because we can actually communicate with each other through the online systems as well, and we can socially interact. It is the physical distance that is important. Hand washing is very important. Hygiene in general is very important. Cleaning the surfaces that may be dirty is important. Online teaching. So I do not believe that students should go to schools because they can actually catch the infections and then they can spread them. So I heard yesterday that some folks are saying that masks are not necessary or schools should open. That is not the right approach. Vaccination, when possible, is the right thing to do. Optimal immune system is very important for us to have. Prophylaxis for the COVID or SARS-CoV-2 is important. Exercise is important. Stress management is important. Stress can actually lead to a weaker immune system. So it is important to have stress management. Then comorbidities management, the blood disorders or cancers or diabetes or hypertension or cardiovascular issues, it is important to manage them, etc. And also be especially careful for those, for the women who are pregnant or lactating. So with this, let's start. The way I have divided the whole paradigm of these drugs that we have been seeing for about 4 months now are in optimal immune system. So this is when we do not actually have the virus, or at least we do not know if we have the virus, but before we are exposed to the virus, we want to make sure that our bodies and our immune system are healthy and able to combat the virus. So optimal immune system in this, so let me just show the categories first. Optimal immune system, prophylaxis, then mild cases, moderate cases, severe cases, critical cases, post-ICU management, and then long haulers. So this is the basic set of categories for which we'll talk about today. And majority of the drugs or supplements that have been discussed here, we have discussed their mechanisms. Maybe there may be 1 or 2 drugs that we have not discussed yet, but we have discussed majority of them. So that should actually be good for you, that you can go back and look at those videos. Also remember, on YouTube, I can only reference 5 other videos on this video. So I cannot really connect to all 10, 15 drugs here. So you'll have to kind of go back to the playlist and look at those if you want to. So optimal immune system, vitamin B1, C, D, K are important. CoQ10 is important. Calcium, zinc, and quercetin taken together is important. Melatonin, magnesium, iodine, selenium, and N-acetylcysteine. In here, some of the drugs are antioxidant, and there may be more than one antioxidant. However, I feel that there are certain antioxidants that have additional actions as well, other than just being an antioxidant, so it may be useful. But if you wanted to say that, hey, I want to just cut down the vitamin to a lower baseline level, then in my opinion, thiamine, vitamin C, vitamin D, vitamin K, calcium, zinc, and quercetin with melatonin are probably the most important one. If it is me, and that is true, I'm going to tell you about my own self, I do take CoQ10 as well, because not only this is an antioxidant, it actually replenishes our ATP making molecular chain as well, and it is useful. So that is the optimal immune system. Then is the prophylaxis. And again, the discussion over here is there is no known or approved prophylaxis yet. So I'll give you references as well for where these drugs have been used. So prophylaxis, I think India is the leading country here. They have been using hydroxychloroquine with, I believe, zinc as a prophylaxis for a long time. And the last data that I had heard was that 74 million essential workers had been given prophylactic hydroxychloroquine. What I do not have from them is the data. And also, please remember, hydroxychloroquine with azithromycin can actually cause, with or without azithromycin, can cause QT interval prolongation, which means that heart attacks can occur. That is one. Secondly, it is also not given in the blood disorders, so that is another. And then it is also not given in retinopathy or the eye issues. So make sure that you do not take any of the drugs over here without talking with your doctor. On the prophylaxis side, can Camostat Meslilate and bromhexine also work? We know that these are TMPRSS2 blockers, and they would block the viral entry. They potentially block the viral entry into the cells, but are they really useful or not? I am seeing a mixture of studies. Some studies saying, yeah, we used it and it didn't work. Some studies are saying, hey, we had a very good result. So I have put a question mark here that are they really, really useful or not? The jury is still out. We still have to know more data to understand it. From a mechanism point of view, they seem to be promising. From an evidence point of view, we do not know yet. We don't have enough evidence yet. Famotidine, that is the peptic ulcer drug, and that has been, famotidine has been prescribed by Math Plus protocol by Dr. Paul Marik, so that may be useful for prophylaxis as well. Again, I put a question mark that do we have enough evidence? I don't think so, but because it is prescribed, it is in the document, I wanted to put that over here. Melatonin is another Math Plus protocol prescription, and that also has its place in prophylaxis. Again, if you have nightmares because of melatonin or vivid, they're not nightmare, they're very vivid dreams. So if that is the case, as Dr. Paul Marik said that day in my interview, that you can reduce the dose. So this is the prophylaxis. The most promising drug here is hydroxychloroquine, but it has its own side effects, which should be really, really, really you should be careful before you take it. And your doctor has to prescribe it. Mild cases. I am considering the mild cases as the cases that are still at a stage where we can be at home. So these are the cases where most of the health organizations say that, hey, you can be at home and take symptomatic treatment, for example, Tylenol or other things, or cough syrups. So that is the mild cases. That is the stage I'm using as mild cases. Once again, in the mild cases, I have seen that hydroxychloroquine, zinc, and quercetin with azithromycin are very successful. I'll keep repeating. Please see, this is not a prescription. So there is a warning with these as well. QT interval can be prolonged. Severe arrhythmias can occur that can cause blood pressure alteration, that can cause heart attack. So please be careful. Ivermectin and doxycycline. Dr. Alam in Bangladesh has used that, and with success. The hydroxychloroquine, zinc, and quercetin, the doctors, so of course, Dr. Didier Rollet from France, I hope I'm pronouncing his name correctly. And then secondly, Dr. Zelenko from New York. They have been the leading guides for this protocol. Ivermectin and doxycycline, Dr. Alam from Bangladesh. Symptomatic treatment, Tylenol or other such things to help with the fever and cough. And this one is important as well, nebulized steroids. So remember that in general, we have discussed that in the early stages, steroids are contraindicated, and that is based on a study where the authors of the study had said that coronaviruses and some other viruses, they are difficult to clear if the steroids are used in the early phases. However, and based on that, WHO says that, hey, don't use it. And want to give a comment over here as well. Some folks send me comments that, hey, do you trust WHO? Some folks then send me comments that, why don't you trust WHO? So look, for me, no politics, no organization. The most important part is the evidence. And this is one area where I think the evidence of having the not having steroids in the early part may need to be reviewed, because the doctors that I've been talking with, outpatient doctors that I've been talking with, they have used steroids in the early phase with success. And here, Dr. Richard Bartlett, so I will put his name over here, Dr. Richard Bartlett, and I'm going to try to have him on our show as well. He has been using nebulized steroid budesonide with success. So is this the time to use the nebulizer? Maybe this is the time. Then low dose radiation. This is a therapy that has not been caught on, but this seems to be a good therapy when especially a person is continuously becoming low on oxygen, who is becoming desaturated or who is going downhill. Then from Math Plus protocol for the mild case is aspirin, famotidine, enoxaparin, and methylprednisolone. And remember, the Math Plus protocol mild case is actually the case which is in the hospital. So this is not for at home. So this is the mild cases and the drugs there. Then are the moderate cases. Moderate cases are where the oxygen levels are dropping fast, where coagulation has started or coagulopathies have started, where the immune system is now going to start taking over, and the virus itself is not causing enough damage, but it is the immune system that is now going mad. So in this, once again, taking inspiration from Math Plus protocol, ascorbic acid, methylprednisolone, enoxaparin, and heparin. Enoxaparin and heparin are anticoagulants. Ascorbic acid and methylprednisolone are, methyl is the steroids, ascorbic acid is ascorbic acid. Now, what are the possible immune modulators? And this is also important. So these are not just immune modulators, they are also virus replication blockers, or they interfere with the virus's activity. So in that, Leronlimab, which seems to be very promising, Remdesivir, which is supposed to be very promising, but I haven't yet seen studies that actually say that, yes, it has been very, very useful. But anyways, that is something that is approved by WHO or by the FDA, and it is being used. Tocilizumab, IL-6 inhibitor. This is an immune system modulator. Lenzilumab, granulocyte monocyte colony stimulating factor suppressor. So it reduces the number of immune system cells or immune response. So that is a drug as well. Itolizumab, that is a CD6 targeting drug. It reduces the activity of the T cell and the action of the T cell. Then Favipiravir, which is a purine nucleoside analog, which is, you can say it is a raw material for the virus, and it is a fake raw material. When the virus uses it, it becomes damaged. That is the same thing with the Remdesivir as well, that it is a fake raw material for the virus. And when it is replicating, it accidentally picks it up, uses it, and then becomes damaged. From the Math Plus protocol, vitamin C. From another study, natural killer cells. Natural killer cells, of course, these are infusions. And the study said that natural killer cells are actually more in children than adults. And that is one of the reasons that children are better protected. So maybe there is a possibility of natural killer cells to be present in adults as well. And we also know that the virus, from our previous discussions, I've discussed all of this in our 110 videos before. Natural killer cells are easily knocked out by the SARS-CoV-2. So maybe providing more natural killer cell may be useful. Then interferon beta-1. So that is another study that came out. And interferon beta-1 helps with the immune, with our cells' defense systems to become shored up or to become strong. So there is a question, is quercetin and zinc used as a prophylactic contraindicated in someone with macular degeneration? Retinal damages are a general contraindication for the hydroxychloroquine. So there is another comment, can't natural killer cells encourage the cytokine storm? So all of these cells can actually cause a cytokine storm that they can participate in it. However, what we have observed is that the immune system goes in a bad state when it cannot handle the virus properly. And that is because either it is imbalanced, or it is genetically incorrect, or it has the components that are not working correctly. And natural killer is one of the components. If the innate immune system can take care of the virus better, and natural killer cells are part of the innate system, then it is possible that the whole amplification of the immune system and chronicity of the immune system can be taken care of. But to continue with the answer here, I have not seen any studies where natural killer cells have been used with success, and there is not much evidence. So that is why I have the question mark here, that do they have a place here at this stage? Then continuing on, in the severe cases, of course, see in the mild to moderate stages and severe and critical, a very important thing is oxygen. And then an equally important thing is how to deliver that oxygen. So should there be high flow nasal cannula, or should there be invasive ventilation? One thing that is really important right from the beginning of the symptoms is prone positioning, and the patient lying down on their chest and then or their stomach, and then breathing deeply. So prone positioning is very important. So severe cases, of course, oxygen is needed. Prone positioning is needed. High flow nasal cannula, oxygen, of course. Ventilation, of course, if needed. And epoprostenol, that is one of the drugs, and then sedation. That is a severe case. I would actually once again say I have the Math Plus protocol open here. So my basic inspiration will go back to Math Plus protocol. Remember, we had talked about Math Plus Plus. So there are some things that we have added as well to the management possibility here. So there's a question, quercetin with zinc, vitamin C, and melatonin, safe for a woman who is breastfeeding, both as prophylaxis and treatment. Look, the quercetin and zinc as a treatment, again, not very clear. However, what is known, so I'm not talking about the COVID, generally what is known is that they are safe in the lactating women, but I haven't seen evidence of usage of these supplements and drugs in the COVID-19 pregnant women or lactating women. So I would be careful. Quercetin is something that is part of our food. We eat it all the day. For example, when we have peppers, or when we have onions, or when we have apples, or when we have strawberries, they have quercetin. And zinc is also part of our food. I would not suspect it to be bad. But again, care is necessary. Your advice from your doctor is necessary. Similar is the case for melatonin as well. Melatonin is our natural substance that is produced in our brain, and it is produced every day. When you become sleepy, it is actually melatonin. So again, it should not have any effect, unwanted effect. But again, dose, it depends upon the dose. It depends upon your body situation, etc. So back here, after the severe cases, and one more drug over here, anakinra, which is IL-1 blocker. Then is the critical cases and the salvage cases. So in the Math Plus protocol, they have kept them separately. I just put them together here. So the critical and salvage cases, plasma exchange. So plasma exchange is different from convalescent plasma. Here you take the plasma out of a patient and then inject new plasma. And so that plasma that was coming from the patient has lots of virus and the inflammatory cytokines and those. So you've taken that out and reduced, in that process, you've reduced those chemical substances. And then when you injected new plasma, infused new plasma, that has lesser of those. So that causes dilution of the overall chemicals that are present. High dose steroids, half dose RTPA, which is the anticoagulants, Tocilizumab, convalescent serum, JAK inhibitors, and once again, yeah, so the Luffy is here. Once again, the best way to look at what these things are is to look at the Math Plus protocol. And we have talked about them in the past. So I have them over here. Then continuing on, post-ICU. So when the patient has been on ventilation, then they come out of the ventilation and they are post-ICU. Then according to Math Plus, continue with the Methylprednisolone, enoxaparin, vitamin C, and melatonin. Then is the long haulers. Unfortunately, the long haulers are the patients who have been most at the disadvantage because there is very less follow-up or very less understanding and research. However, what I've seen that day when I was talking with Dr. Paul Marek, he said statins are something that are interesting. The anti-inflammatory effect of statins can be used. And similarly, I have seen that Deltacotril has been used as well. So that is a steroid. So this is the basic landscape of all the drugs that we have been talking about and various doctors have been using, and various protocols have been developed on top of this. So I am kind of proud that within 22 minutes, we have gone through all of them. Now I want to do another thing. And once again, I will give strong caution that please, these are not prescriptions for anyone. This is educational video. So what I'm going to talk about now, to me, it is both interesting and something that evidence has been showing, plus it has risk as well. If I go with WHO's guideline, then what I'm showing here is not according to their guideline. And then if I look at the evidence that is coming out of many of the countries, then it is interesting to have the observation. So from an educational point of view, I think we should look at it. And that is, if the management was entirely based on steroids. So look, steroid, no symptoms or prophylaxis, steroid do not have a place in there. Over there, the supplements, the hydroxys, and those drugs, maybe Camostat Meslilate type things, they are possible Quercetin, Zinc. Steroid do not have a place in the prophylaxis. In mild cases, Dr. Richard Bartlett, he said that he has been nebulizing patients with budesonide, and that has been very useful. So maybe there is a place of that generally. And then on the same case, I have been talking with some of my friends who have been practicing, some here in the US and some outside. And they have been saying that in the outpatient, one of the key drug they've been using is the steroid, even in the symptomatic, early symptomatic patients. This is where WHO comes out strongly and says, do not do that because it can reduce the virus, it can reduce the virus clearance and cause issues. However, I think that this is something to be observed, to be learned, and to be looked at, that steroids are being used in the early symptomatic phases, and they have been successful. Then in the moderate, severe, and critical cases, as you have seen with Math Plus as well, Methylprednisolone, or as the Oxford study showed, Dexamethasone. If you think about it from Dr. Paul Marek's point of view, Dexamethasone is not the right drug to use. The right drug is Methylprednisolone because of better presentation to the lung tissue. That is the same thing with Dr. Richard Bartlett's point of view for the nebulizer. He said that, well, in the early phase, imagine if you do not want to use steroids because that can cause immunosuppression and issues with the virus. He said that, hey, I'm using it as a nebulizer, so the only area of the body that is being affected is the respiratory system. And over there, he says it is very, very effective, and this is not a systemic issue. So that is a similar message from Dr. Paul Marik, that methylprednisolone has a better penetration for the lung tissue compared to dexamethasone. And then in the long haulers, my own observation from my friends and my own work has been that Deltacotril, which is one of the short-acting steroid, has been very, very useful. Maybe combined, Dr. Paul Marik's advice was to combine with statins. So if you look at it here, this is all a steroid line. So it is possible that the steroids in general, with maybe hydroxy or ivermectin combinations, are sufficient. And right from the beginning, maybe nebulizer, like with Dr. Richard Bartlett's, and then methylprednisolone from Dr. Paul Marik's. And finally, I wanted to show a visual placement of these drugs. So look on this side, these drugs here. So this is a cell, our cell. This is the coronavirus, which is trying to enter our cell and then going to replicate and make copies of it. So if we start from here, blocking the coronavirus, possibilities are antibodies and vaccines. So if somebody has a vaccine, I'm talking in theory now. I'm not talking Moderna. I'm not talking Oxford. I'm not talking any specific vaccine. I'm not talking about if the vaccines are right at this time, if they're effective at this time, if they're safe at this time. I'm just talking about the principle of vaccines, that they train our immune system to release antibodies and to attack the virus when it arrives in our body. So vaccines and antibodies are useful to attack the virus and kill it, or to train our immune system. Vaccines would train our immune system to attack the virus, and antibodies themselves are going to attack the virus directly. So these are the monoclonal antibodies that are neutralizing antibodies. Then, when the virus wants to enter into our system, over there, the drugs that are interesting are the TMPRSS2 blockers, which are Camostat and bromhexine. I did not put an M there, so bromhexine. So these are the ones that can suppress the TMPRSS2, which in turn can suppress the priming of the S protein, which would reduce in theory, reduce the entry of the virus into our cells. Once again, there have been all kinds of studies and experiences that say they work or they do not work. Similarly, hydroxychloroquine, the mechanism of action, because it makes a cell alkaline inside the cell, it is possible that during the alkaline phase of the cell, the fusion of the virus with our cell membrane becomes stalled or slowed, and that reduces the virus entry. Then within the cell, zinc, which would have to come in with the help of either quercetin or hydroxychloroquine, zinc can disrupt the viral enzyme RDRP and reduce the virus replication. Then, if the virus has started replicating, then the drugs that act as fake raw material for the virus are the Remdesivir and Favipiravir or other antivirals. These act as fake raw material. The ribosome from our cell will pick up this raw material in light of the genetic instructions from the virus's messenger RNA, and it would try to build a new virus. That virus would now have fake raw material in it, which would cause the production process of the virus to be aborted in the middle, and the virus will actually, maybe just the hand of the virus will be made and done. Then there are drugs here that make our host system, our cell, stronger. So what are those drugs? Ivermectin is one of them. Remember that ivermectin prohibits or stalls or disrupts the virus's cargo from going into the nucleus and to cause the nucleus to lower its defenses. So ivermectin blocks that process and keeps the nucleus of the cell to work to defend itself. And then similarly, interferon B1 that we talked about a few days ago, maybe yesterday or day before, that also helps the cells to stay strong, plus the immune cells to be modulated properly. Then when the virus is trying to get out of our cell, it uses the ribosomes plus the Golgi apparatus. And over there, hydroxychloroquine once again is useful because it causes the environment in these organelle to become basic in nature, less acidic, which causes these systems to work lesser. This is the same thing with the RDRP as well, that hydroxychloroquine would stall the RDRP as well. So that is the area where we are trying to damage the virus itself. Of course, you can look at the whole thing here, and we are making the virus either not enter the cell, or once it has entered, not replicate, or if it is replicated, it is replicated with the broken raw material, or the cell itself has gotten better defenses to behave, to defend against the virus. Then on the immune system side, there are a few drugs here that are going to work on either modulating the immune system or suppressing the immune system. And the kind of drugs that you would see here are either they modulate one part of the immune system or they suppress the whole immune system. So of course, the ones that would suppress all of the immune system are steroids. Steroids would suppress immune system plus inflammatory system, and that is how they calm down the whole thing. Then if you look at the other focal modulators, then of course Leronlimab is one that disrupts the CXCL5 and CCR5 axis, which causes the immune system activation to be stalled and reduced. So that is one drug. Then interleukin-1 blockers like anakinra is another drug that would cause the immune system's activity to be reduced. Then IL-6 blockers, for example, Tocilizumab. IL-6 is once again another chemokine that is released, and that in turn, it is released by the immune system cells, and then in turn causes the immune system activation. Then granulocyte monocyte colony stimulating factor. This is a factor that is released by the active immune system. It goes and acts on the bone marrow to say, hey, make more WBCs, which are going to be more immune cells coming in to fight. And so when we block that, that causes the immune system to be calmed down. So Lenzilumab is, for example, such a drug. Then CD6 blockers. CD6 blockers are the blockers that would block the T cells. So, for example, Itolizumab is that drug. Then we have epoprostenol. Then we have coagulopathy controllers, for example, heparins or enoxaprins or aspirin. So this is the general discussion for all the drugs that we have been seeing so far. I am sure that there are tons of more material out there. There are tons of more literature out there. There are more experiments out there. But this is something that we have been looking at in the past, and I wanted to have that review. So what do you think? That was I'm pretty proud that we talked about it in 33 minutes. One request that I'll make of you is that please like, subscribe, and share. And one complaint I have from my Facebook friends is that I'm seeing very few shares from you. I see a good activity on YouTube, but I see very few shares. So if you like what we are doing here, if you support it, then please share it with others. So this is the discussion for today. What do you think? I'll just take a couple of questions and then we will break. So there's a question here. How about in case of possible reinfection, will steroid affect the body-acquired immunity? So the thing is this, I do not have evidence for the reinfection. Reinfection in theory simply means the virus entering our body again. Fine, that can happen. It is a re-disease. That is, once the virus has replicated enough and spread enough that it causes symptoms, then that is a disease. I have not yet seen any evidence that the reinfection of the virus leads to disease again. There are anecdotes, people saying, hey, this person was positive, it is positive again. Now, was that the kit wrong? Or was that the virus was actually never cleared out? Was that a person a long hauler or a carrier? Or was the method incorrect? Was the different kit used before, which was probably not sensitive enough? A better kit used now, which was more sensitive? I haven't yet seen the evidence for reinfection. So at least I am disabled from talking about it because I don't have enough evidence. So then when will we get a breakthrough? So Kyler, if I show in here there is a, if you see, the steroids are a very interesting thing. The only thing is there is a hesitation even on my part to use the steroid in the early part. I would probably follow Dr. Richard Bartlett to say that, hey, he finds that nebulization is interesting. There should be some studies done there. If that is the case, in my opinion, hydroxy type drugs, ivermectin hydroxy with steroids and supplements should be sufficient. Again, this is all theoretical. This is all educational. I'm not sitting here and saying this is the cure. Just like yesterday, I was hearing someone saying hydroxy is the cure. Hydroxy is not the cure. It is a drug that helps, but it is not the cure. So there is a question by Puru. What do you eat to keep you so full of energy? So if I tell you honestly, the whole day when I'm preparing for you all, I'm very anxious at that time. I'm trying to collect the material. I'm trying to make sure that I present something that is worth your while and worth humanity at this time. And I don't accidentally make mistakes. I don't overlook something, and I don't cause any issues. So that is the time when I become very, very anxious. But once I have prepared, once I'm presenting to you, this is the reward for me, to have your time and to be able to present to you. So this is what gives me energy. I hope that these discussions are saving lives. That is my reward. So what is my, ITJ says, what is my supplement regime? I have posted a picture on Twitter. I usually take vitamin D, vitamin C, CoQ10, NAC, N-acetylcysteine, glutathione, calcium, vitamin K, and then vitamin B. With that, I take 1 tablet of multivitamins in general. So that is what I usually do. Closet Picker, this is why I love you. Thank you very much. Can ivermectin be used as a prophylaxis? Good question. I haven't yet seen ivermectin used as a prophylaxis. However, hydroxy has been better. But ivermectin has been very safe and very useful and competes with hydroxy very well. So ivermectin plus doxy combination versus hydroxy with azithromycin combination, I feel more safe with ivermectin and doxy because hydroxy and azithro both can cause prolongation of the QT interval. So there is a question, there is a comment indeed, Closet Picker. Daniel says, I wonder what all the research being done, will this end up affecting our ability to combat more common? It is possible. So much research has been done. The whole world is busy with trying to figure out how to handle the virus. We are trying to figure out how to stay hygienic. We are trying to figure out how to keep our immune systems better. We're trying to repurpose drugs. We're trying to find new drugs. We're trying to find vaccinations, monoclonal antibodies. There are new ways to create vaccines, faster ways to create vaccines. So I think that there has been an upside for medical research and medical outcomes as well. I just wish that this evil virus goes away soon without causing more damage. Thank you very much for helping and discussing drug mechanism and potential therapies. I just wonder why rich countries had more. So can I say this? So this is a very good question, that why rich countries have done more. So I'm going to say this with lots of respect. I live in the US as well. I am here. What I'm seeing is that in the less resourceful countries or countries with less resources, their doctors have to figure out a way to find a solution. So they are trying almost everything. In the richer countries, there are more rules, regulations, and unfortunately, on top of that, more politics. And then on top of that, I think more economic things from big pharma, small pharma type things. Then on top of that, more adherence towards organizations that have been leading, for example, WHO and others. And if you see, WHO has made so many errors. And I'm saying that as a doctor. This is not a politics here. They have made so many errors and caused so much damage in their taking a road and then taking a U-turn and then taking another road that they should not be doing. They're not one-person team. I'm a one-person team. I have a bigger team though, but I'm not WHO. If I can go find things, why cannot WHO do those kind of things? So I think the richer countries have become more affected, not only because there may be factors like socioeconomic factors or obesity or more comorbidities or weathers, but I think there is a political, economic, and leadership, and I'm talking about medical leaderships like WHO, issues there. And we here in these countries, in developed countries, we are used to living by rules. So if WHO said, here is a rule, we go and adhere to that. I mean, think about it. You cannot prescribe drugs here without somebody looking at you and saying, did you prescribe correctly or not? And your license is in danger. These are the kind of things that are not happening in other countries, where it is rather easier to test various things and then arrive at a solution. So there's a Joby, alas, if only our CDC had a comprehensive information. Absolutely. Imagine that if CDC had a site where this kind of a thing is over there, and with every drug, they had some sort of a information to say, this drug has been tried. We do not know that if it is going to be useful or not. We are looking for evidence, but here is something that somebody did. Or let's say they had Dr. Richard Bartlett's comment over there that, hey, I've used nebulizer. And they're saying, hey, we've used nebulizer. This doctor has done this. Maybe there is an advantage, but here is our caution. So they could have done it. How many are the drugs there? But and it is funny that some folks think that I'm on WHO side, some think I'm against WHO. I'm actually not on the side of Republicans or Democrats or WHOs or CDCs. I am on the side of us all. And I'm trying to figure out what are the ways that things may help us. So Gamer says, Dr. Me, we want to see a video of pros and cons of different technologies of vaccines. Absolutely. I have done 2 or 3 videos before about vaccines, their mechanisms, newer vaccines, and their possibilities for positives or negatives. I was going to do one more. Today I was thinking about vaccines, but then yesterday we decided to do this lecture today. Hopefully tomorrow I will do an update on vaccines. Correct. So Pam says that we call it red tape. Correct. So we are stuck in the red tapes. Syed Azam says, your team is bigger than WHO. I think this is the ambition and this is the hope to be able to serve at this time. So I think that is what is happening. So this is where we are at. I'm going to stop here so that the video stays digestible. And please, once again, my request to you is like, subscribe, and share, especially my Facebook friends who are watching. Please share. You have stopped sharing or reduced sharing. Please share if you like it. If you don't like it, then that is fine. Cool. So guys, see you tomorrow. Guys and gals, see you tomorrow. And stay safe, stay healthy, and stay happy. And we'll talk again tomorrow. Bye-bye.